So in our previous videos, we learned how we can use our breath to help link our deeper core muscles with our pelvic floor. Using that information that you already have, we're going to jump into some exercises. Now, because we're early postpartum, we're going to make sure that we gradually move into our exercise progression. If you're having any symptoms such as heaviness or pressure while you're doing these exercises, I want you to modify by decreasing the amount of motion that you're having. If that does not improve your symptoms, I want you to go ahead and stop. The same thing goes along with pain. If you're noticing pain with these activities, modify, and if modifications don't help, please stop this activity. So now before we begin, I want you to make sure that you also have water nearby, because if you need to, take a break, take time so that way you can allow yourself to do the exercises properly, but also make sure you get enough time to recover in between each. Let's go ahead and jump into some of these exercises. To get on the ground, I ask that you roll onto your side and then gently onto your back. We're going to begin first with just some breathing exercises. Make sure you allow for the pelvic floor to fully relax. With each breath that you take in, you should feel the tummy muscles gently rise into your hand and also those pelvic floor muscles letting go, moving away from your body. Go ahead and take 5 deep breaths. At any point, if you need to pause this video to complete the activities, please do so. Also know that you can move at your own pace and that the repetitions are merely suggestions. For our first activity, we're going to start with bridges. Before you even lift your bottom off the ground, make sure you gently pull the belly button towards your spine. As you're keeping the belly button towards your spine, you're going to push with your feet to lift your bottom up. Make sure you're not holding your breath. If it helps, you can think exhale with exertion. In this case, the exertion would be lifting of your bottom. Try to do 10 of these, and then if you need to, please take a break. At any point, if you notice any pain or discomfort with any of the activities, I ask that you modify them. If modifications do not alleviate the symptoms that you're experiencing, please stop the activity. For the next activity, I'm going to have you once again gently activate the belly button. In order to do that, you can also do a pelvic tilt, allowing for your lower back to flatten against the mat. Now you're going to maintain that tilt and march one leg up, bringing the knee towards your chest. Try to avoid any excessive rocking and also arching of the back. If you can, try to perform 8 to 10 repetitions on each side. But at any point, if you feel as if your body is becoming fatigued, please take a break. As we finish up this last set of brace marching, remember at any point you can pause the video if you need a longer period of time to rest. For the next exercise, you're going to maintain that belly button contraction. And I'm going to have you gently straighten out one leg, allowing for that knee to remain straight the entire time. For the leg that has been straightened, you're going to lift it up, trying to bring it up equal height of the opposite leg for the knee that is bent. In the beginning, this may be challenging, and that is okay. If you can only lift the foot up for just 1 or 2 inches, start there. Try to do 10 repetitions on each side. And remember the helpful tip that we've already given. Exhale on exertion. This will ensure that you're not holding your breath as you're performing this activity. Exertion for this activity is when you're lifting the leg. So as the leg is going down, you can inhale, and as the leg is rising up, that will be the portion where you're exhaling. Take a moment to breathe and catch your breath if you need. Feel free at any point to pause the video to allow yourself extra time. For the next exercise, you're going to use a ball, a towel, or any type of pillow, something that you can place in between the knees. With the object placed between your knees, you're going to squeeze the knees so that way you can gently add pressure against that object. As you're squeezing that object, you're going to also contract your pelvic floor. So if you can recall from the previous videos where we did the blueberry pull, this is where you're going to do the blueberry pull or even try to imagine that you're stopping the flow of urine. This will allow for the muscles on the inside of your thighs along with your pelvic floor muscles to contract. This can be very helpful in managing incontinence and also signs and symptoms of any heaviness in the vaginal region. As you do this activity and begin to progress, you'll notice that you're able to squeeze and maintain the squeeze a little bit longer. In the beginning, especially if this is your first time doing it, start with just a 1 to 2 second squeeze each time you push into the object. As you progress, you can do up to 5 to 10 seconds. Next, I ask that you move that object to your hands. With the arms pointing straight up towards the ceiling, you're just going to gently push the shoulders forward. As you push the shoulders, try to minimize the crunching that you're doing with the entire body and limit it to just your shoulder region. So your shoulders and your upper back should lift away from the mat. Just as before, make sure you're not holding your breath. Exhale on exertion. Exertion with this activity is when you're moving to lift your body away from the mat. This exercise can be very helpful with rib movement and also to help you recover from the diastasis recti that is a common thing and a normal adaptation in pregnancy. For the next exercise, go ahead and roll onto your side. We're going to do 2 different exercises on each side. For the first one, we're going to start with clams. Keep both knees bent and leave the feet together. The top leg, you're going to move away up towards the ceiling. As you do this, make sure you're not allowing your body, especially your torso, to roll backwards. Try to keep your hips and shoulders in line the entire time. As you progress this activity, you're able to use a band around the knees. Feel free to start with a light resistance band if you feel like you're ready. If not, that is okay. The body weight itself is enough. For the next activity on your side, we're going to have you bring one arm underneath the shoulder for the hip that is closest to the ground. The opposite arm is going to be placed directly in front of you. You're going to use your muscles on the side of your torso to help you lift and push the hips up. Your arms are there to help you stabilize because as you're recovering in the postpartum phase, you may notice your core strength is not quite what it used to be. So the arms can help you to stabilize and also to help compensate as you gain your strength. Remember, exhale on exertion. With this activity, the exhale is occurring when you are lifting the hips away from the mat. Once you have completed both of those activities on one side, go ahead and roll to the opposite side. And now we'll start our clams. Just a gentle reminder, make sure that as you perform this activity that you're not allowing the torso to rotate. You want to make sure that in order for this activity to work, that you're using the appropriate muscles. With our clams, try to begin with somewhere between 8 to 12 repetitions on each side. When we move into these modified side planks, try to start with somewhere between 6 to 10, depending on your current activity level and also just your current level of fatigue. You may notice that you have to take longer breaks with the more activities that you do. It is common as you fatigue to begin to try to hold the breath. If you're noticing you're wanting to hold your breath, that is your cue to stop and take a break for now. Our next activity, we're going to have you go into a crawling position where you're on all fours. In this position itself, you're going to allow for the arms to stay straight, and we're going to do donkey kicks. I want you to keep the belly button pulled up towards your spine. And you're going to take one leg back to gently lift the knee up and away, pushing that foot up towards the ceiling or towards the sky. Try to maintain the back in a straight position and avoid arching. If you're able to, also avoid rocking side to side, as that is a common compensation. For this activity, the exertion period is when you are lifting the leg. So exhale on exertion. Exhale when you lift the leg. I want for you to aim to try to do between 6 to 10 repetitions on each side. You may notice that one side is a little bit easier, and that's quite fine. Make sure that you focus on just maintaining your posture and keeping the appropriate muscles activated without holding your breath. And as you finish up this activity, this is a great position for you just to practice breathing in. Remember, as you breathe in this position, that your tummy will drop down towards the ground. The next activity we're going to have you do is just a modified plank or bear crawl. You're just going to gently lift the knees away from the ground as you're able to. The easier this one gets, the more movement you'll notice you're able to get away from the ground. As you perform this activity, try to keep that belly button pulled in towards your spine. And remember, exhale on exertion. Exertion for this one is when you're lifting away from the ground. Try to do between 5 to 10 repetitions.